Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about supraventricular tachycardia.
Well, supraventricular tachycardia occurs when your heart rhythm gets out of control. Now, normally the heart rate is between 80 and 60, certainly less than 100. But when it gets to be greater than 100, then you start thinking, wow, what is that? Normally, the heart mechanism is such that there is an electrical system that controls your heart rate. In other words, the heart beats in a very controlled way. But when that becomes out of control, then the heart may beat very fast. It may be 140, 150 beats a minute, and maybe even higher. And that may be supraventricular tachycardia. Usually that would be the problem. And that occurs because now the heart is not using its normal conduction system. So these beats emanate from an area of the heart, usually the atria of the heart, and that's what results in the heart rhythm change, and it's what results in the heart beating so fast. Now, an EKG will tell us, where does that rhythm come from? Is it a dangerous rhythm? Could it be something that leads to a more serious problem like ventricular tachycardia? Well, not usually. Usually supraventricular tachycardia is something that is not life-threatening, but is not something that's comfortable. Nobody likes to walk around with a heart rate of 140 or 150. So this is something that has to be treated. A shock, an electric shock, can get the heart back to normal. The normal rhythm can be restored this way, or medications, and sometimes just intravenous medications are enough to get the heart rhythm back to normal.
So if I had a loved one who was recently diagnosed with supraventricular tachycardia, what would be some of the questions you would recommend to ask their doctor?
Boy, the first question is, why? What happened here? And there are many things that can cause this. Things like hyperthyroidism, certainly heart disease of various types can cause supraventricular tachycardia, or it can be something that kind of just occurs on its own. And some people actually are born with a tendency towards supraventricular tachycardia. So, knowing what's causing it is helpful, but a lot of times there's not so much that you can do to treat it unless you take medication. So there are medications that can help control the heart rhythm. Those are important. Your doctor needs to understand exactly what that rhythm is and if those medicines work. Now, if they don't work, then what else can be done? Well, depending on the rhythm, there are different procedures that can be done that could actually help control the rhythm and redirect things back through the normal channels. So supraventricular tachycardia, very annoying. It can be hereditary, usually is not, usually does not result in sudden death, but certainly is something that needs to be treated and to understand why it occurs in the first place.
Thanks, doctor, and thank you for watching. And be sure to visit hearthealthcommunity.com to learn more about supraventricular tachycardia.
Thank you.